Hello, my name's Rebecca Cheatham, and thank you for tuning in to our presentation on how you can unlock the power of CHWs or community health workers within your organization. CHWs have been a hot topic as healthcare is now looking at social determinants of health more than ever, and the role of CHWs has the opportunity to directly impact those social determinants of health. For today, we're going to be walking through a little bit about what qualifies a person to be a CHW, followed by some additional information on different services and uses for community health workers within your organization. And lastly, we'll talk a little bit about some updates to billing for CHWs as new policies have been released from Medicaid to actually be able to reimburse for those services. So to start, let's go over some qualifications for CHWs. To meet the demands of today, including these assets in your organization can be extremely valuable to your patients and community. One of the best aspects of utilizing CHWs is that they do not require formal training or certifications beyond those to be a certified community health worker. This opens up to a larger potential recruitment floor for getting these individuals into your organization. To be a CHW right now, at least in the state of Kentucky, you must be a legal U.S. resident, be employed in a role as a CHW, be at least 18 years old, and meet and maintain that CHW certification or get recertified. So, what is a community health worker? CHWs are essentially trusted members or individuals that deeply understand the community they serve and can act as a liaison between health, social services, and the community. Essentially, they're there to connect patients where there have traditionally been gaps in care, either in access or education. To put this into a little bit more of a visual, we can view CHWs as a bridge between the community and health system constructs of the chronic care model, which demonstrates the continuum of care for patients to reach improved outcomes. Having that connection to create productive interactions between community resources for care and the health system of care results in informed and activated patients that can have the important conversations and interactions that are needed with those prepared practice teams. This is crucial to being able to provide good interactions between the patient and the healthcare system as a whole. So, why the current interest in CHWs in particular? This is because that chronic care model is becoming more and more important. There's a increased diversity in the population more than ever. We have a growing prevalence or at least recognition of the prevalence of chronic diseases in the population. We have a growing complexity of the healthcare system as a whole. There's also that recognition of social and behavioral determinants of health that I mentioned earlier. There's also the renewed commitment to reducing health inequities. Of course, there's cost pressures on the system, and this role as a CHW can significantly help with that. There's also shortages of clinical personnel time that is with the actual patients. CHWs are truly there to help fill in those gaps and promote improved outcomes for patients to help address all of those current stressors in the healthcare system. At the end of the day, we typically see the health system portion of care as that largest influence in a patient's overall health, but a CHW's role in providing the community aspects impacts the outcomes of the patient significantly over time. We know CHWs are there again to fill in the gaps in care between community resources and programs in existence and the healthcare portion of care. So let's take a look at some specific services or ways a CHW can fill in the gaps. So some core functions of a community health worker can be to facilitate communication between the patient and provider. They can help with promoting health education. There's providing patient education as well. That's very important within the clinical setting. There's also preventative services that a CHW can cover or talk to the patient about. They can also help with navigating and coordinating health resources for the patients. And then there's other services that are approved by the Department of Medicaid Services that can be covered. So all of these services can be broken down a little bit further. One overarching theme is resource and health navigation. To me, CHWs show their true power the most in this realm. I mentioned before that complexity of both of our healthcare system and the diseases that many of these patients are managing have become a tremendous negative effect on being able to access and receive appropriate care that patients need. CHWs can be that force to help patients from start to finish, helping to find appointments that'll be covered for specific services, financially even, and finding those providers locally is a major benefit that CHWs bring. But they don't stop there. They also help at each stage of the patient going through the healthcare system, assisting with transportation, in even attending appointments with patients, so they can help break down any medical jargon is just as valuable. Then, once the patient's done cycling through and leaving the appointment, CHW can then step in with post-care resources to help the patient manage any identified health concerns and regain some additional efficacy in their own care, such as pointing a patient in the direction of a support group. There's also the before or after connection with the healthcare side that CHWs can assist with. There's a number of health promotion services that community health workers can provide, from health education and promotion, tobacco use cessation, and even alcohol reduction and abuse treatment recommendations are two very large ones. There's also the ability for community health workers to step in and help out with family planning services and physical and mental fitness coaching. Then there's also a very big one around nutritional improvement resources or even food insecurity, addressing those within the patient population. All of these promote efficacy within patients around their own health and utilizing the services and resources that are already available to them. Another major role of CHWs is in providing direct patient education and training. Most commonly, these are around immunizations, blood pressure management, STI management, diabetes control, things that patients are usually going through over a long period of time. But they can also be more in depth or cover some additional relevant topics to the patient, depending on what programs either the CHW is working with or that patient population is needing addressed. Thankfully, there are more options now for receiving funding for community health workers as the value in these positions and individuals has become more and more evident. Let's start with the types of provider organizations that can actually bill Medicaid for community health worker provided services. These can include alcohol and drug treatment entities, behavioral health services organizations, as well as the community mental health centers. Then health systems as well can bill for CHW services with a couple stipulations. With health systems, they have to have at least one hospital and one group of physicians, or they have to have at least more than one group of physicians. Hospitals can also bill for these services in addition to smaller organizations like an FQHC or FQHC lookalikes. Local health departments, primary care clinics, rural health clinics, all of these entities have the ability to bill for certain CHW services. There are some additional stipulations, of course, to what is covered. To bill for services provided by CHW, they must be related to a medical intervention outlined in the patient's care plan. Nor can the CHW be enrolled as an independent Medicaid participating provider. Additionally, a CHW will not be reimbursed, that is paid by federal funds, whose reimbursement is included in per diem or cost settlement payments, or those that are employed by a managed care organization. Now, this isn't to say a CHW may not work for a managed care organization, just that the reimbursement for those services will be handled by the MCOs themselves. Another thing to note is that fee-for-service Medicaid will reimburse for CHWs. So each one of these is something that you want to consider whenever looking at either bringing in CHWs into your organization or finding some other routes to help fund what services are already being provided. Again, thank you for tuning in today. If you do have any questions or concerns, you can always feel free to reach out to us here at the Kentucky Regional Extension Center, as well as any of our other services that we have listed out. Thank you, and I hope you have a good rest of your day.